Today marks the beginning of a week dedicated to collaboration, innovation, and shared inspiration.
We are here to really configure a platform for proper networking in digital health, for interchange of good practices, and for doing business.
This European Digital Health Summit that we are opening today aims at all these advances. I am convinced that it will bring food for thought and challenges to all of us.
These innovations are thrown at the front line on the shoulders of clinicians, nurses, social workers, that together with unexpected partners that are tech companies and engineers voluntarily try to implement, overcoming challenges and bottlenecks that are not born at the end of the process. They are born much earlier. They are born in the administrative complex pathways that are our worst enemies.
We are at the defining moment for digital health in Europe. I think that we share the fact that digital health is at the core of Europe's health systems in competitiveness in general, and I would say also technological leadership. In our opinion, the European health data space will only succeed if it is shaped, tested, and used by those who will build, but those who will deploy, and those who will use these technological solutions.
But the human factor is not capable to go as fast as the technological one. We need to be aware that we need also to nurture ourselves, okay? All this aspect of being aware of the technology in our lives and trust the process, trust technology, but on top of that, trust the people who actually builds all that.
Digital healthcare is not only a health issue, it's an issue about European competition. If we succeed in that, we can succeed in many other sectors as well. And we have potential, I fully agree. We have potential in this sector, much better potential than Americans or Chinese.
Europe can lead the next wave of digital transformations in health. And we can do it because we have the talent, because we have the regulatory foundations for it. We do know, we have strategies, we have investments. Now we need this collective determination and rapid actions.
The big challenge for AI is not there. It's education for people in the middle of their careers. I have a prediction. Half of the jobs that you do here will not exist in 5 years. That poses a tremendous challenge for any system, in particular the healthcare system.
In Finland, actually, the ministry went through quite an interesting study last fall, which was about trying to calculate how much of time do the healthcare professionals, especially the medical doctors, spend each day on this manual work for patient medical record documentation, and it was really astonishing.
And then the One Health approach is to realize that the health of humans does not depend only on the health of humans, but does also depend on the health of the environment and on the health of animals.
We have the Ministry of Health, for example, doing the surveillance of an antibiotic in drinking water, but then we have the Ministry for the Environment doing the surveillance of the same substance in surface waters. And then we have these separate databases, and if we want to analyze all the data from the AMR perspective, we need to go and dive in different data sets, and it's so complex.
How the machine should be installed, so you could further decrease the scanning time with around 10-15 minutes, reducing it from 25 minutes to less than 10 minutes. And you can imagine that that's a big, significant improvement to be made for a hospital, because in the end, one of my key points is it should make sense for the customers. If you want to include AI in solutions, it should really assess and address a clinical need.
It's the existence of obsolete IT devices and systems that are still connected to critical infrastructure networks, although they no longer receive security updates from the manufacturer. So we see it as an open door to attackers. And actually, so we know that there's an interesting stat. So 60% of EU cyber breaches in 2023 exploited known vulnerabilities for which there were security updates, they were available, but they hadn't been applied.
People don't know why their data is needed. We need to make a lot of educational efforts to tell people your data is data for good, is going to build better therapies, better treatments for your colleagues. It's going to be secure, and here is the rights you have. The data is being collected for secondary use, but you can opt out.
First, for data integration, we see that there is fragmented data across hospitals, public and private, insurers, national health systems in Spain with the 17 different national health systems that we have. And we see a clear need to really work on interoperable platforms to improve patients' and clinicians' experience.
So if you take all this together, the point is that we are doing things now, but we need to think about the next step, and that is the role for the academics and the research bodies.